The Ontario government recently brought in a color-coded system to help people visualize the risk of contracting COVID-19 in their community. At this point, the Thunder Bay district is in the green or prevent stage. Currently, the district also has over 40 cases, but no one is in hospital. However, we are seeing an average of 5 or 6 new cases each day. As well, the health unit is urging anyone who attended a pickleball event at the Polish Legion Moose Hall, North McIntyre Rec Centre, or West Thunder Community Centre in Thunder Bay between November 3rd and 13th to self-isolate right away and contact the health unit. To help us understand what is happening in our district now, I'm joined by Dr. Janet DeMille. She's the medical officer for the Thunder Bay District Health Unit. Dr. DeMille, good morning.
Good morning, Amy.
For so long, we saw our numbers stay so low. Yesterday, you put out a video message stressing that things are changing here. So how would you characterize the shift that we're seeing right now?
Well, I think we've definitely sort of entered the second wave here in the Thunder Bay District for sure with our latest, the last couple of weeks of cases and what we're experiencing. We certainly did do very well over the summer and in the first few months of fall, but that seemed to change very dramatically a couple of weeks ago, obviously. And really what's driving this increase of cases is two fairly significant issues. One was, a week and a half ago when we had an outbreak in a supportive living environment, and then of course this weekend with the pickleball related exposures.
So given the uptick in cases, people might be wondering how close we are to moving into that yellow category of the province's COVID framework. What is keeping us in green right now?
So it is really about the process about how a health unit will be moving through. And of course, this is it's a fairly new framework. It was initially launched on November 3rd, and then the indicators of when health units might move up the scale, or however you want to describe it, these were further adjusted last Friday. So this is fairly new. And we're not quite fully aware of the process about how the decisions are made. I have some ideas about it, and I will be getting more. But certainly what other health units, including, of course, public health at Sudbury and districts, it's usually Friday that it has been announced, and it gets implemented. The new stage and the limitations in the new stage get implemented on Monday, 12:01 a.m. basically. So I am anticipating, if it follows the same, that we might that the official decision or it actually gets implemented or put in the regulations associated with the Reopening of Ontario Act, and so it is a government decision. The regulation is updated, but if we're looking at the same timelines, we'd be looking at knowing on Friday and then having it potentially implemented on Monday.
In the meantime, what is in your toolbox at this point in order to address this?
Well, certainly we're very aggressively managing our latest exposures that occurred on the weekend, and that is an ongoing process. And I think it's really a tremendous amount of work that my team has done on this, and it is getting under control for sure. And I just want to express my appreciation to everybody who's out there who's cooperating and talking to us, providing us the needed information. This was really a huge situation that happened. We continue all our usual work in supporting businesses and workplace and in enhancing measures. I put out certainly my update, a video update yesterday, really wanting people to pay attention of what's happening and really, as you say, recommit to all of the measures, regardless where you are. And, we're doing that restaurant blitz that we put out in the media on Monday as well. That's just one of the examples. So we continue to do that. And of course, we're looking at what yellow would entail and if we do go that route, then certainly being able to support the businesses that are going to be impacted by that.
You mentioned the incidents that have been linked to pickleball games in the city, and you've asked people to contact you immediately if they were involved in those. What is the urgency behind that? It
was really on Friday that we recognized that there could be COVID-19 exposure related to pickleball events that have occurred in the city in the last couple of weeks, and that was because basically two individuals who were positive both had that as one of the places that they had attended, and that sort of triggered, well, is that where they got it from? And then as we start to understand, the pickleball and how games and sessions are played, it certainly raised a very significant concern that the virus could have transmitted at those events, and it could have transmitted to a number of people. And of course, all of these individuals have their own lives and their own households and, work that they go to. So we knew that it could be, potentially a very significant exposure with significant implications. So there was a sense of urgency on this. This was also, we did have initial contact list of some of the people who had attended some of the recent events, but we did really want to broaden it out. And one of the tools that we have and that we implement very quickly, of course, is asking people to stay in their homes and isolate. If we believe that there's a group of people that could be potentially incubating the virus, they might feel completely well and not have symptoms, but they could have COVID, and of course they could become infectious and spread it if they carry on their usual activities. So we'll often ask people, please, or direct people, please self-isolate, call us so we can get, the information from you, what you were doing when, and better assess each individual's risk level, but also provide them guidance and instructions, because they, if we believe that they were really exposed, that can be quite concerning to people, obviously, and we want to support them through that. And if they do happen to develop COVID, and of course we've seen many of them have, then we want to support them with that. That's not an easy situation for them to be in either.
Mm-hmm. So just to clarify about the pickleball, is it the fact that people were doing a physical activity, is that part of what makes it a high risk situation?
Yeah, that's certainly something that is of concern, is that physical activity. The virus can get out of us if we have COVID when we breathe, right? If we're breathing hard and sort of exercising, more of those droplets can get out. And of course, if anybody is nearby, that could impact them. So exercise has always been an issue of concern, and needing to implement, in any exercise or recreation facility, the proper measures for that. So that is definitely part of the risk assessment that we were doing when we recognized that was a potential exposure site.
With higher case numbers, of course, comes more concern about people in assisted living facilities. The Minister of Long-Term Care has said it's up to local health units to add additional measures to protect vulnerable populations. What are your thoughts on that? Would you like to see clearer or stronger guidance from the province?
So I did hear that yesterday, and I have to admit it did cause me a bit of confusion, because there is direction through directives from the Chief Medical Officer of Health to long-term care homes, and that's how it's usually done. So some of the visitor restrictions and the limitations to protect long-term care home and even retirement homes come down that way. I do know that some of my colleagues have, through methods available to us, have implemented, us as medical officers of health, have implemented stronger restrictions when they've seen rising cases. That is not an ideal way to do it, in my opinion. It certainly just puts a lot of extra work on health units or medical officers of health. But, we're always sort of looking at the various things, protecting vulnerable populations, and recognize that is a significant vulnerable population, and working with our long-term care homes and the organizations in being able to put those measures in place as needed.
Here in Thunder Bay, officials at the hospital have been advocating for travel restrictions. Are you looking at implementing travel restrictions for our area?
Yeah. It's not quite travel restrictions as opposed to sort of recommendations. And I heard in the news just now, Northwestern Health Unit. So we've been, and what their restrictions are. And in fact, we were in the process of developing ours, and updating ours, and that got sort of waylaid a little bit by all this recent activity we've had to do. But, and we were connecting with the Northwestern Health Unit over the weekend to ensure, ideally that we would have consistency, for Northwestern Ontario. And in fact, I think might be coming out with it today. And it is basically the same thing. It's really recommending that people don't travel outside of Northwestern Ontario if they don't need to, if they're not sort of an essential reason for that travel. This is not the time to travel. So that's the fundamental travel recommendation we have. But if people do go, when they come back, we do want them to stay at home, limit essentially their interactions with others outside the home, stay at home for 14 days, especially if they are returning from any high-risk areas. And as we see, and as the Northwestern Health Unit has clearly identified, Manitoba in particular is probably the highest risk area that we have right now.
Dr. DeMille, as always, I really appreciate your time. Thank you for joining us this morning.
Thank you, Amy.
Morning.
Thank you, Amy.